This is Tanja Zerenner, who's going to tell us a little bit about motor complications in Parkinson's.
Good morning, everyone. I've joined the team around Michelle, working on the discovery cohort a little over a year ago now, as a data manager and statistician. And as in this room, probably you all are aware already, one reason why we are collecting so much different information from the study participants, so questionnaires, biosampling, imaging, assessments in clinic, is that Parkinson's is such a multifaceted condition. And I am using the data that's collected in the discovery cohort to better understand how long after diagnosis people typically develop which symptoms or which complications. And then in a second step, to figure out if and how we can forecast what an person's Parkinson might look like in, say, 2, 5, or 10 years' time. And for the most part of the presentation today, I'll be talking about motor complications in Parkinson's disease and what we found regarding those among the participants of the discovery cohort study. So just briefly, what are motor complications in Parkinson's? Motor complications are side effects related to the long-term use of Parkinson's medication, levodopa in particular. And there's 3 different types of motor complications that people can have. So there's dyskinesia, which are uncontrolled, involuntary, kind of twisting, jerking movements, which can be tricky to distinguish from a tremor, but they are more unsteady and more disorganized in nature compared to a more regular tremor. Then there are motor fluctuations, which is also referred to as the wearing off phenomenon, which means that people can have fluctuations between periods where a person's Parkinson's medication is working well and their symptoms are well controlled, and periods where the medication is less effective and symptoms return, which we also refer to as the person being in an on state when the medication is working well, and in an off state when it's not and symptoms return. And the third type of complications are dystonia, which are also involuntary movement but caused by stiffening or contractions of muscles. And for this project, we've used the data from the discovery cohort, but not only. We've also included the data that's been collected from what we refer to as discovery sister cohorts, the tracking cohort, which is coordinated by the University of Glasgow, and the PPMI cohort, which Michelle already mentioned in her introduction. And the things I want to look at today in this little presentation is how common are motor complications among the participants of these 3 cohort studies, how much is daily life of the participants impacted by these complications, and can we understand which groups of patients do develop motor complications more or less frequently. So before I get to the results, let's have a quick look how this information is actually collected from the participants. So this is a question from the MDS UPDRS-4 questionnaire. That's one of the questionnaires that's done with every PD participant of discovery at every regular clinic follow-up visit, so every 18 months approximately. And what this question asks regarding this dyskinesias type motor complications is, in terms of the number of hours each day spent with these complications. So the clinician will ask, how many hours are you typically awake during the day? And out of these hours, how many do you typically experience such dyskinesias? And then based on the ratio between those numbers, the clinician will assign a score between 0 and 4, where 0 means the participant doesn't have any dyskinesias at all. A score of 1 means slight, which corresponds to the participant having dyskinesias for no more than a quarter of their waking day. 2 down here, more severe, 3 or 4 to corresponding to the participant having 50% of the day or even 75% of the day dyskinesias. So this is a summary of what we found among the participants of the discovery study, tracking, and PPMI. And from left to right, you see the 3 different types of motor complications. And the length of each bar indicates the percentage of cases who are still in follow-up at that time who experience these motor complications. The time is here from top to bottom, so 0 to 2 years after diagnosis to 10 to 12 years after diagnosis, where we are roughly in discovery right now. And what you can see here is that at a later stage, these motor complications are quite common in Parkinson's disease. So at 10 to 12 years, about 50%, 10 to 12 years after diagnosis, about 50% of the participants do experience dyskinesias. And off state, so these fluctuations between medication working well and working less well is even more common. So about 60% experience this after 10 to 12 years. But unfortunately, you see that most of this bar here is the light gray shading, which means it's just a score of 1 in this questionnaire. So this is just patients who have this for at least less than 25% of their waking day. So it's common, but most people don't have it more than a quarter of the waking day. You see dystonia is much rarer, but you can also see here more darker shading. So from our analysis, it currently looks like that dystonia is rarer, but if someone experiences dystonia, it seems to be more persistent during the day. So the next question I want to have a look at is how much is the life of the participants' daily life impacted by these complications. And again, I want to take a quick look at how we collect this information from our study participants. So this again is a question from the MDS-UPDRS-4 questionnaire that's done with every PD participant. And what this question asks is if people during their dyskinetic or off-state periods, if they are still able to go about their daily life, or if they are prevented from participating in certain activities or social interactions due to their motor complications. And again, this is rated by the clinician with a score from 0, means the dyskinesias or the off-state doesn't impact or interfere with the life of a patient, to slight, where it makes some things more difficult, but the participant will still be able to do most of the things he or she usually does, to 3 or 4, indicating more severe impact on everyday life. So this is, again, some results. So this is what we found among the participants of discovery, tracking, and PPMI. So here the different colors correspond to the different motor complications. So dyskinesia is shown in orange, off-state is shown in blue, and dystonia is shown in gray. And here you have the percentage of cases over time. And on the left, you just have the presence of motor complications. So this is the same information that I've already shown you in this gray bar chart, just in a different type of picture. But here now next to it, can now see the percentage of cases who report that these complications are interfering with their daily life. And on the right, you have the percentage of cases of participants who report moderate to severe impact. And what you can see here is that, so if you look at the orange line, dyskinesia, you see this is a lot lower here in the middle picture than to the left. So for many patients, or for many people, it seems dyskinesia has no or only slight or very little impact on their daily life, if it's not too severe. And for off-state, you see a different picture. You see there's just a tiny little difference here. Just go down a little bit. So being in an off-state apparently almost always impacts with the daily life of a study participant. Okay, then the next question I wanted to look at for motor complications is which groups of people do experience these motor complications more or less frequently. And one little analysis we've done here is we've grouped people according to their Parkinson's medication, how much medication they are taking. Or more precisely, we've grouped them according to their LEDD, that stands for levodopa equivalent daily dose, and it's a way of summarizing the Parkinson's medication that a patient takes in terms of its equivalent dose of levodopa. And you see here a similar picture to what I showed you on the previous slides, and now the bluish color here, that's the 25% of participants on the highest medication dosages, and the brown line on the other end are the 25% of participants on the lowest dosages of medication. And as expected, you see that motor complications are more common amongst those people on higher medication dosages, as you'd probably expect. But you can also see that the effect seems to be different for the different types of complications. So you can see that for dystonia, all these three lines here at the bottom are really close together, and only the ones on the highest dosages show an increased risk of, or more frequently experience dystonia. Then we've done a similar thing where we've looked at two groups according to their age at diagnosis. So here our orange line is the group of participants who've been diagnosed at an age less than 70, and the blue line shows the group of participants who've been diagnosed at an age of 70 or greater. And you can see here that all types of motor complications are more frequently experienced by the younger participants. And that is partly due to what I've just shown on the previous slide, that younger participants are often prescribed higher medication dosages. But at least from a little further analysis, it looks like it's not solely explained by that. So there's a bit more to it than just that. And then the last one of these kind of slides I want to show you is where we've grouped people according to their medication response. So how much their symptoms typically improve after medication. And here the orange ones, the orange group, are those with a smaller response to medication, so who feel less ease in symptoms after taking medication. And the blue ones are the participants who better respond to medication. And you can see here that people with a better or greater response to medication also more frequently experience motor complications over the course of their Parkinson's. So these were some results from a project that I've been involved in over the past year. And in the coming months and years, my work will focus a lot more on if or how we can forecast what an individual person's Parkinson's will look like in the future. And we want to do this, as Michelle said, to give people newly diagnosed with Parkinson's the best information that we can on what to expect and when, of course, only if they want such information, if such information is requested. And also for us researchers as a research tool to have a way to identify the people who are best suited for a clinical trial. It's a challenging task though, because Parkinson's is such multifaceted and everybody's Parkinson's is slightly different combinations of symptoms at different times and so on. But already in previous studies we found that even though it's challenging, we can do something about it. So this is a figure that you might have seen at a previous Open Day at a presentation by Michael Lawton already. This is from one of his papers from 2018, where he's grouped or clustered Parkinson's participants according to how they present at baseline, and then looked at how these people progress in terms of their motor symptoms over time. And you see that the groups, according to their, who present differently in clinic at baseline, will progress in terms of motor severity faster or slower. So there is some information in how a new person with Parkinson's presents at diagnosis in terms of predicting their progression. And we are only really focusing on this so much now because apart from large cohort size, you also need a long follow-up to be able to study rarer outcomes or rarer complications in Parkinson's, which only occur in later disease. And some aspects that we want to look at are risk of falls, risk of cognitive impairment and dementia, risk to develop freezing of gait, and so thought that dependence or independence from carers in everyday life might be an important thing to consider. But I'd be happy to get your input and your thoughts on what you feel is really important to you, what you feel is important for people living with Parkinson's in general, and what else should be definitely added to this list. If you've got any comments or suggestions, they are very welcome, also via email later on if there's no time today. Thank you.